Hey, this is Brooke, functional medicine dietitian specializing in fertility, and this is the Fertility Dietitian podcast, where I help you uncover the barriers that are preventing you from optimizing your fertility and teach you how to work with your body to finally take home a healthy baby. Each week, I will be diving into different topics on fertility and sharing my perspective on physiology, metabolic health, nutrition, and lifestyle approaches that have helped hundreds of couples get pregnant even after years of heartache. My goal is to empower you with the knowledge you need to take back control of your fertility. Happy listening. Today, we're talking about secondary infertility. Okay. Fertility is not static. Just because you didn't face any challenges having one child or two or even three, it doesn't mean having another will come easy. Having trouble conceiving after having at least one healthy pregnancy affects 3 million women in the US alone, and it's called secondary infertility. If this is you, you are not alone. This actually represents roughly half of all infertility cases. Unfortunately, it is common to be told to just keep trying if you've already had a child. But this is really poor advice because there's so much more that you can do to improve your fertility and decrease your time to another healthy baby. The quality of egg and sperm and the health of the reproductive environment change with time and exposures. So, exposures like nutrition, lifestyle, and environment, and just overall health. Okay. The cause of secondary infertility is just as complex as primary infertility. So, you will hear me refer to many previously recorded episodes as many of the same factors are going to apply here. Okay. So, the first thing to think about though is how you recovered from your last pregnancy. So, pregnancy, postpartum healing, breastfeeding, and caring for a tiny human takes a lot of energy and resources. If your health was borderline prior to pregnancy, or you were really depleted prior to that pregnancy, your body needs extra time to recover and replete nutrients, which means resources are steered away from reproductive function. Research shows that waiting at least 18 months before trying to conceive again is ideal for recovery and nutrient repletion. Appropriate recovery time from a pregnancy is important for healing your cervix, healing your uterus, healing your endometrial blood vessels, and pelvic floor. It also decreases risk of complications in the next pregnancy, including preterm birth, anemia, abnormal bleeding, neural tube defects, developmental delay, cerebral palsy, and autism. Okay. More time is often necessary if there are underlying health conditions or complications during the previous pregnancy or postpartum recovery period. So, you're probably wondering what you can do. Well, first, we need to think about what's happening with gut health. We need to optimize your gut health. Remember that your gut bacteria impacts your immune system and what you will be passing on to baby to build their immune system. Learn much more about gut health in episode 18. Right? Eat a nutrient dense diet, including whole eggs, slow cooked meat, fatty fish and seafood, high quality dairy products, fermented foods, fruits and veggies, and prioritize protein starting with breakfast, making sure that you are consistently eating enough overall. Okay. Incorporate movement like walking and strength training. Up your sleep game as well. The quality of your sleep really matters, and aiming for a minimum of 7 hours, striving for 9 hours is really important too. This makes a big difference in how your body's able to rest and repair and really support overall hormone balance and egg quality. Spend time in nature and soak in the sunshine whenever possible, daily, ideally. Find your zen and learn how to best adapt to stress. Okay. If you're wondering what that means, tune into episode 23 for much more details here. Also, think about minimizing your toxic burden by reducing exposures to endocrine disrupting chemicals. And I have a whole episode on this topic as well. Episode 13 is what you want to listen to for more info on supporting our detox pathways and decreasing toxic burden. And last, but certainly not least, prioritize male fertility too. Sperm can change significantly every few months, okay? And much more is recorded already on this topic in episode 6. So we have to prioritize male fertility as well. Okay. They're 50% of the puzzle, not only important for getting pregnant, but staying pregnant and having that healthy pregnancy and healthy baby as well. Okay. Some labs that you might want to consider include a gut health test or a stool sample to check out what's happening with your microbiome. This is going to impact how you're getting those nutrients out of your food to support things like egg quality, hormone balance, what's going on with your immune system, inflammation in the body, and so on and so forth. Again, lots more on gut health in episode 18. Okay, blood sugar and insulin resistance labs are really insightful. Things can change a lot after pregnancy, postpartum time. Okay, a lipid panel, super important for what's happening with hormone balance, egg quality. A full iron panel, very important for what's happening with lining health, how our cells and tissues are being oxygenated, and so on and so forth. A full thyroid panel. If you're wondering what those things mean, I do have a preconception checklist that you'll want to download. It outlines all of these individual lab markers. You can just print it out, take it to your provider. So there aren't any questions asked around this. That can be found in my digital store if you're interested in getting lots more details around those. Homocysteine and CRP are inflammatory markers that are important to check out and have interpreted by somebody who knows what they're looking at. So homocysteine is going to tell us about how you're using certain nutrients that are really important in the DNA programming of an egg and sperm. So therefore the quality that you are getting with your eggs that you're maturing. And then micronutrient testing via an HTMA or a hair tissue mineral analysis test. And this is the first time you're hearing about that, episode 19 is definitely what you want to tune into. It will tell you everything you need to know about this type of testing too. Okay. The majority of my secondary infertility clients need more time to recover as they went into their last pregnancy depleted without even knowing it. And this time can be drastically reduced if you know how to better support your body or are able to meet it where it's at and work with it, which is where that testing piece comes in. Okay. So we're able to target areas that are barriers much more specifically. And it is okay to need help on this journey. It can be so frustrating. Lots of questions of why this is happening, especially after you've had healthy pregnancies in the past. But fertility is complex and it is not static. So looking at your whole body is important for best outcomes. I am always here for you. Don't hesitate to reach out. Thank you for listening to this episode of the Fertility Dietitian podcast. If you enjoyed it, please leave a review to let me know what topics you want more of or less of. If you want to keep learning, subscribe at Apple Podcasts, Spotify, or wherever you listen to podcasts. Check out my website for more info on my private coaching program, Master Your Fertility, or my membership community, Fertility Blueprint. And don't forget my digital store. Come say hi on YouTube and Instagram. See you in the next episode.